Hello everyone and welcome back. I got a fun one today here, kind of a trick for internal bleaching. So as you can see, a lot of staining on this lower incisor here. Over the course of a couple weeks, we did a walking bleach technique, and this is where we ended up after 3 changes. So she was incredibly pleased. Didn't want to over bleach it, but I did want to do something to kind of make the root structure look a little bit better. So after cleaning everything off, what I'm going to do here is place a bonded opaque composite right up against that dark root structure there. So go ahead and do a normal bonding process like we would for any other tooth. And at this point, what we're trying to do is increase that value. It's very difficult to bleach root surfaces. I've tried before, it doesn't really work that well. So this is a trick that I kind of developed to help this area look a little bit better in the post-op. It's not going to be perfect. Ideally, she'll get a graft. She was ecstatic no matter what, but I decided since we're in there, we may as well clean up a little bit. So what you do is take this flowable opaquer. I use this primarily with restoring PFMs to block out the metal, and you almost use the Endo Explorer like a paintbrush here and brush it up against that buccal surface where the dark area is. And what this is going to do is kind of make it pop and make that darkness a little less obvious. So this is a trick you can do if you have a tooth that maybe was over bleached. You can actually use a darker shade underneath, like an A3 or a nice Denton shade. And then, also what we're going to do here, which is use a really opaque shade to help brighten up the tooth structure as well. In this case, the restorative dentist likes to see the patient's back, so no big deal. I go ahead and put the sterile sponge in like we normally do, and then go ahead and put some Cavet on top of the tooth. But in a second here, you'll see the change is very subtle, but it is a slight improvement. It doesn't take very long at all. And we can take a tooth that looks like this, which we're pretty pleased with. And as you can see, the root surface has popped. It is a subtle change, but it is enough that it does make a difference. So that was a quick one here. I just wanted to give you guys kind of an idea of a new way to approach bleaching. Just one more arrow in your quiver. If you have any problems with that, let me know. Otherwise, thank you so much for watching, and I will talk to you next time.